What have you been hearing about how hospitals have been coping?
Well, they've been preparing for it for some time. It's hugely disruptive. If you think about waiting lists, everybody on the waiting list during this period has to have their appointments cancelled, and you have to make absolutely 100% sure you've contacted everybody, which is not easy. Then you have to, afterwards, you have to fit them in where there's already 7.5 million people on the waiting list. So the administrative burden, sort of back office burden on the NHS, which people don't often talk about, is huge and very disruptive and very costly because you have to bring in new staff to do it.
Well, that's right. And some of those costs have emerged this week, haven't they? That if you've got junior doctors on strike, you may have to pay more senior doctors to come in to take their place.
Sure. And of course, when the senior doctors are off as well, as they have been in the last couple of days, the whole thing comes to a grinding halt. All the elective procedures, as we call it, that's like new hips and knees and hernias and cataracts and things like that, they just get cancelled. A lot of the diagnostics get cancelled. And so although, the doctors say, oh, well, it's going to be safe because we're doing Christmas Day service at the blue light front door and A&E is going to be OK. Actually, a lot of patients are at risk because they're not on a waiting list for fun. They're there because of a clinical priority. That clinical priority gets shelved, whatever it is that's wrong with them. They've either got nothing wrong with them or something that needs to be fixed wrong with them. And that gets parked as well. And we're starting to see the emergence of numbers now where patients are at risk, excess deaths are starting to emerge from the numbers. Now, the BMA fiercely contests those numbers, and in fairness, it probably is early to take a conclusion, but common sense tells you if people are on the waiting list and they don't get seen, they're at risk, they are at risk of harm.
And in the meantime, we've heard that hospitals in Devon have entered what they describe as the highest level of escation. Yeah. What does that mean?
Yeah,
how bad do things have to get for them to...
Well, it sure vary is the answer, but viewers will probably know it better as code black or red. That was how it used to be done, but it was done on a local basis and it wasn't a national agreed template. Now it's called Opal, and there are 4 levels, Opal 1 to 4, 4 being the worst. And this area is declared Opal 4. That means that they can't provide safe care. Now, that's really very important. Now, you get Opal 4 normally if there's a big local car crash or a terrorist attack or something like that. And what that means is that patients can be diverted to somewhere else. That's OK under normal Opal 4 circumstances. But where you've got Opal 4 circumstances like you've got it now, you've got one hospital that doesn't have enough staff saying we're not safe, trying to send patients to another hospital who doesn't have enough staff and not safe. And I'm worried that this is going to start a domino effect across the region. And before you know it, there'll be other hospitals and other regions declaring Opal 4. Now, if it gets to several regions declaring Opal 4, then the government, well, not the government, but the sort of the centre, the Department of Health is supposed to step in and do something. Well, what can they do? They can't end the strike. No one, the government won't enter into talks. Everybody is very intransigent. There's nowhere to go with this until the strike ends on Saturday. So, I mean, this is... I don't want to, what we call in the NHS, I don't want a shroud wave, but this is really very serious.
And you say that you talk about this impasse at the moment between the strikers and the government. What do you want to see happen next?
Well, look, we know, don't we, every dispute in our lives, I have a row with you and in the end we end up talking about it. You're your neighbour, wherever you work, all rows end up in talks. Now, the Prime Minister has made it very difficult because he said there will be no more talks on this year's pay for the doctors. Now, when the Prime Minister says something, it's going to take a huge screaming U-turn to get back to talking. So that's put the Secretary of State, I think, in a difficult position. And so they can't talk. So what happens then? Well, the doctors say that they won't have, they will only talk about pay restoration and they want 35%. And I think... most people will take the view that 35% is, a third increase in your salary is really too strong and it can't be done in one lump. So if I was negotiating, I'd say, OK, we can't talk about this year. Let's make that the foundation year. Let's talk about next year and the year after. and have a 3-year deal and try and get a package together that gets them back into pay restoration. But the issue here really is that the successive administrations have exploited a pretty dozy trade union. The BMA have let the doctors' pay slip through their fingers, I think. And now, of course, they're scrambling to try and catch up, which is not really possible. The only other alternative I can think of is that the patients clearly are at risk of harm. Doctors' registrations depend on doing no harm. That's the General Medical Council, the GMC. Now, the GMC could caution doctors that their registration might be at risk if patients come to harm. They did that in 2016 when the doctors last went on strike, when Jeremy Hunt was the Secretary of State for Health. So, I mean, there are plenty of options, but at the end of the day, they have to talk to each other. And the government, I think, has the overarching responsibility to keep the public and its citizens safe. So I think the government are going to have to swallow some humble pie, I think.